overwhelming majority of the American people understand that the pharmaceutical industry is ripping us off.
3 House Democrats are holding up the ability for Medicare to negotiate down prescription drug prices. And Bernie Sanders is calling out their crap. So he was on MSNBC with Chris Hayes, and this topic came up. Check it out.
You mentioned the pharmaceutical industry, and I want to follow up on a conversation we just had about those 3 Democrats on the Energy and Commerce Committee who voted against Medicare drug price negotiation plan as proposed. That's Scott Peters of California, Kurt Schrader of Oregon, Kathleen Rice of New York. They say, hey, look, we need a bipartisan, bicameral solution. What do you think of that?
Yeah. I think it's totally absurd. I mean, you have a Republican Party, which is a right-wing extremist party right now, which is owned by the pharmaceutical industry. The polling out there is just unbelievable. Whether you're a Republican or Democrat, overwhelming majority of the American people understand that the pharmaceutical industry is ripping us off in an unconscionable way. You may recall, I've made 2 trips to Canada with people from Vermont and people from the Midwest. We bought insulin and other prescription drugs for 1/10 of the price that the drug companies are selling the same product here in the United States of America. Thousands of people die every year because they can't afford the medicine that they need. The question is whether we have the guts to stand up to what is an incredibly powerful lobby. Do you know how much money these guys in the pharmaceutical industry have spent over the last 20 years on lobbying and campaign contributions?
I don't.
You know?
Nope.
$4.5 billion. You know how many lobbyists they have on Capitol Hill right now? Twisting arms. They got 1,200 lobbyists. That's 2, more than 2 per member of Congress. So they don't lose. They have owned the Congress forever. And whether or not we can stand up to them and defeat them and finally do what the American people want, lower the cost of prescription drugs, is something we have got to do.
So, of course, Bernie Sanders, a clear voice on this issue, has been very consistent on this issue. And if you are from outside the U.S., like I am, you're aware of just how ridiculous the cost of drugs are in America. So insulin is 10 times the cost in the U.S. compared to Canada, just as one example. And as you see there, Bernie mentions there are more than 2 lobbyists for every member of Congress from the pharmaceutical industry. Just wild. So these 3 members of the House Democrats that voted against this, Representative Scott Peters of California, Kathleen Rice of New York, and Kurt Schrader of Oregon. If any one of these are your representative, time to primary. These are people that, we're going to see maybe Justice Dems, another group looking to primary one of these out after or in their next reelection. But it's absurd to have these Democrats aligned with pharmaceutical companies joining the GOP in voting against the ability for Medicare to negotiate down drug prices. Now, of course, let's look at why that is. So taking a look at Ken Klippenstein here, tweeting out, as David Dane writes, those 3 I just mentioned, but you take a look at their money from Open Secrets. So you go to Open Secrets, you can look up any one of these representatives, where they get their money from, what industries. Kurt Schrader, one of them here, pharmaceuticals is one of his top industries where he gets money from. Of course, as is Scott Peters, one of his top industries. Now, interestingly enough, Kathleen Rice is not on this list. I don't know why Kathleen Rice is voting against with everybody else, but she does get a lot of money from the health insurance industry, so that may be a part of it. But a little more here. So nearly 18 million U.S. adults couldn't afford a prescription medication this year. Just showing you how incredibly expensive. And I've done many stories, where it's discovered that, this pharmaceutical giant decided to triple the price of this cancer drug all of a sudden because they knew that their patients needed it. And this happens again and again and again, and they get away with it. Or at the worst, they get like a small fine that has no impact on them whatsoever. But a lot of people simply can't even afford these prescriptions. And this is in addition to, of course, the lack of access to healthcare, not having Medicare for all. That's a whole other discussion, but that obviously has a major impact on the health and wellness of Americans all across the country. The preventative measures are one of the best ways to address serious healthcare issues, or issues that could become serious if they're not addressed early. Medicare for all, guaranteeing healthcare to everyone, would then allow people to visit their doctor earlier if they suspect something, as opposed to waiting to the last moment when that healthcare issue has ballooned into a much larger issue, which becomes a lot more expensive, and that becomes an issue both for the individual but also on the system. But still, these are taboo subjects in a lot of circles in Washington. Last thing here from Common Dreams: Medicare, the largest buyer of prescription medicines in the U.S., is currently barred by federal law from negotiating prices with drug manufacturers thanks to a non-interference clause that progressives have long sought to repeal. Democrats' current proposal would amend the clause to allow the Secretary of Health and Human Services to negotiate prices on behalf of Medicare, a plan that could dramatically cut costs for patients and produce hundreds of billions of dollars in federal savings over the next decade. And as Bernie mentioned, support for this is universal. Republican voters support this. Democratic voters, of course, support this. But even Democrats having Congress and having the White House, they still are unable to pass this just because of the sheer amount of power the pharmaceutical and private health industry has over politicians.